So I'm Dr. Ann Pittier, and I'm a radiation oncologist in Tacoma, and I've been talking to my patients about a whole food plant-based diet for over a decade. It helps with their cancer, but my goal is actually to make them healthier after their diagnosis of cancer than they were before. So today I'm going to be talking about diabetes and how whole food plant-based diet can help prevent, reverse, and mitigate the problems associated with it. So CDC declared diabetes an epidemic in 1994. And since that time, the incidence has tripled. So diabetes is now affecting 11% of the population, pre-diabetes, 38% of the population. That means almost half of our population is affected by diabetes. We are projecting this to jump. In 2060, we're expecting a 700% increase in people under the age of 20 getting diabetes. Now, the reason the CDC publishes this information is so that providers can help people prevent and control diabetes. And so, indeed, diabetes can be prevented, reversed, and the disabilities associated with it mitigated. In response to the epidemic, the National Diabetes Prevention Program was initiated. And the goal is that they want to get the medical community to implement two interventions, to get people to lose about 5 to 7% of their weight, and to have people exercise just the minimum amount, 150 minutes of exercise a week. And with this, they predict that diabetes would drop by about 58%, and even more so in people over 60 by 71%. So these are two very achievable goals. But can we convince our patients to alter their lifestyle? So interestingly, 75% of our patients believe that they are living a very healthy lifestyle. And now a healthy lifestyle has been defined as having all four of these criteria: exercising, which is the minimum amount, 150 minutes a week, so 30 minutes 5 times a week. Healthy eating, which they simply defined as getting the 5 servings of fruit and vegetables a day. Also, a normal body mass index, which is under 25, and not smoking. So where do we stand? Well, the reality is that less than 3% of our patients actually qualify as having a healthy lifestyle. So 90% of people in America do not eat the 5 servings of fruits and vegetables a day. 70% of us are now overweight. And interestingly, half of us don't know that we're overweight. So healthcare providers are not doing their job in talking to patients about this. 19% of our population still using tobacco products. Now, 11% of our population smoking cigarettes. The rest are vaping, juuling, chewing, and they don't consider that necessarily tobacco products, and they don't think it's as bad for them. 75% of adults are not routinely meeting the exercise requirements that have been set forth. And now the authors in this study that looked at healthy lifestyle decided not to add in added excess sugar, because when they did, it dropped the population down to meeting a healthy lifestyle to less than 1% of people. So, sorry, that's in the way. So, poor health is starting at a much younger age in this country, and that's contributing to the predicted 700% increased risk of type 2 diabetes. So 34% of our kids are overweight and obese, and 33% of children will develop type 2 diabetes in their life. Now, in the Black, Indigenous, and people of color population, this is even higher, 53%. And this is tragic. It shaves off 13 years of life on average. So the National Diabetes Prevention Program wants us to concentrate on weight loss and exercise, and we really need to have evidence-based messaging for our patients. So before we jump to Ozempic or bariatric surgery, we should be giving our patients a chance. We should be recommending the diets that actually have been found to reduce weight. And now we have this nice meta-analysis of 12 randomized controlled trials that followed patients for at least 18 weeks, and they found that vegetarian diets were associated with more weight loss compared to non-vegetarian diets. With the vegan diets, being associated with the greatest weight loss. Also, exercise, I think we can all talk to our patients about the minimum amount of exercise, but I actually really feel that it's important to stress that the optimal amount of exercise has been looked at as well. And that's 45 minutes, 7 days a week. So when we tell our patients, 150 minutes a week or 30 minutes 5 times a week, they think that's maximum, but it's really the minimum amount they should be doing. So diabetes is the 8th leading cause of premature death in this country. And diabetes affects almost every disease on this list. So if you're diabetic, you have 2 to 4 times the risk of heart disease and stroke. You have a greater than 20% increased risk of cancer. You're 30% more likely to die of COVID. 81% of Alzheimer's patients have diabetes. 70% of diabetics have non-alcoholic fatty liver disease. This has now outpaced alcohol as the leading cause of cirrhosis in this country. And 30% of diabetics will go on to develop kidney disease. So we need to be promoting dietary patterns that are associated with the least amount of diabetes. And we have, you can see in the bar graph here, an association between diets, body mass index, and diabetes prevalence. So body mass index and diabetes prevalence follow the same trends. So what you're looking at in this bar graph are groups of people who are taking animal products out. So it starts with the red line there, the non-vegetarian, the standard American, and they tend to have the highest body mass index. Once you start taking animal products out, so you go semi-vegetarian, pesco-vegetarian, down to vegan, you can see that the body mass index tends to drop, with the vegans being predominantly the only group maintaining a normal body mass index over time. And you can see that type 2 diabetes mirrors this prevalence. So so actually the standard American, the non-vegetarian, is suffering with the most diabetes. And for every group that's reducing animal product intake, you can see that the diabetes prevalence drops, with vegans being having the lowest likelihood. In general, vegetarians are 45% more likely to have a normal body mass index, and vegans are 65% more likely. So we've had an evolution of the understanding of our pathophysiology of diabetes. Diabetes has been recognized back to the Egyptian manuscript in 1500 BC. In the Middle Ages, we considered diabetes a disease of the kidney. In the 18th century, pancreatic injury. It wasn't until 1910 that we discovered insulin, and in 1922 injected it into the first patient. It was 1936 that we actually differentiated between type 1 and type 2 diabetes, and insulin resistance was defined. Interestingly, the primary cause of this insulin resistance remained unclear until recently. So really, our working theory up to 1999 was simply that the body is resisting insulin via unclear mechanisms of action. There's blood sugar excess causing a feedback loop such that insulin secretion is increased, and we eventually get burnout of the pancreatic beta cells. So really, diabetes became this defect in processing sugar. And so what happened was the healthcare community said, well, let's really recommend diets lower in sugar so that we can try and reduce the sugar in the bloodstream. And so healthcare providers started saying, well, why don't we try low carb or keto diets? Now, during this time, thankfully, there was a pharmaceutical explosion in terms of therapeutics directed at reducing blood sugar. But interestingly, epidemiologic studies that were also being done during this time was giving a conflicting narrative. So we have the Adventist Health Study that looked at vegetarians and found that vegetarians had half the risk of developing diabetes compared to the meat-eating counterparts. Over a 17-year period, non-vegetarians increased their likelihood of developing diabetes by 74%. We have the EPIC NL study. They looked at animal versus plant protein and found that that the highest intake of animal protein was associated with the highest risk of developing diabetes. And they specifically looked at dairy and eggs, poultry and fish, and found that consuming 5% of animal protein at the expense of 5% of carbohydrate or fat increased diabetes by 30%. And if you looked at large groups of people who started deviating away from a plant-based diet, they found that those people increased their risk of type 2 diabetes by about 23%. Now, the National Institute of Health, knowing that diabetes is associated with insulin-like growth factor 1, did a very interesting study. They looked at 46,000 people. They controlled for body mass index and macronutrients such as fat and carbohydrates, and simply looked at how people were getting their protein and what that was doing to diabetes. So if you got your protein from animal sources, you had a fourfold increased risk of dying from diabetes. So clearly, recommending a keto diet or a high animal protein diet in diabetics is harmful. They did not see this impact with the plant-based proteins because it doesn't increase that IGF-1. So back to the evolution of our understanding of the pathophysiology, it wasn't until 1999 that researchers at Yale used MR spectroscopy to measure intramyocellular lipid concentration, and they correlated this to insulin resistance and progression of diabetes. So what they found was that if you had higher serum lipids, you had more accumulation of intramyocellular lipids, which impacted insulin receptors and decreased transport of glucose into the cell, causing hyperglycemia. So this is really important. And I think that a lot of providers don't know this information because it really should be impacting how we're talking to patients about their diabetes and how to try and reduce it from progressing. So high-fat diets downregulate the genes required for mitochondrial oxidative phosphorylation in the skeletal muscle. In genetically susceptible individuals, 50% of the population, we'll see a reduction in the mitochondrial activity in association with the accumulation of these lipids. And this leads to about a 60% lower glucose uptake by the receptor. So what you're seeing in this picture is that the fatty acids are activating a serine kinase cascade, leading to reduced insulin activation. I don't have a pointer to show this to you, but and that leads to a reduction in the glucose transport as well as reduced glycogenesis. So vegans have a significantly lower intramyocellular lipid concentration compared to omnivores. So this is why we're seeing from all these epidemiologic studies that vegetarians and vegans have the lowest rates of diabetes. So after this information came out, researchers looked at a low-fat vegan diet and wonder if I can move this. No. And how that impacted cardiovascular risk factors in type 2 diabetes. So what they did was they took diabetics who had hemoglobin A1C around 8, and they put them either on the recommended American Diabetic Association diet, which was lower in carbs, higher in fat and protein, and they compared this group to a low-fat vegan diet. So in this graph over here, the red line are the patients on the ADA diet, the blue line is the low-fat vegan diet. And what they found is that the low-fat vegan diet, when you compared it to what the doctors were recommending, the American Diabetic Association diet, the A1C dropped 47% more. They reduced LDL significantly more, weight was reduced more, and more patients came off medications. Now you can see that everybody had a bit of a benefit, but the low-fat vegan diet was associated with a much greater benefit. You can look at the macronutrient content of the American Diabetic Association diet, and you can see here that it was actually much lower carbohydrate than the low-fat vegan diet. The low-fat vegan diet was 70% carbohydrate versus less than 50% with the ADA diet. And the protein content much lower, and yet the low-fat vegan diet had significantly better results. So the link between animal products and type 2 diabetes is well known. So we now know about how saturated fat contributes to the insulin resistance through intramuscular lipid accumulation, reducing glucose transport. Also, we have advanced glycation end products, which really come from the meat and dairy that we're eating. And this is directly linked to the oxidative and inflammatory stress, which contributes to insulin resistance. Nitrosamines and heme iron from red and processed meats generate free radicals, leading to oxidative stress, inflammation, and insulin resistance, and has been found to be directly toxic to the beta cells in the pancreas. Persistent organic pollutants, so the forever chemicals that we're hearing about in the media, are endocrine disruptors. They accumulate in animal fat, and they are too associated with insulin resistance and impaired beta cell function. And then animal protein itself stimulates IGF-1, linked with a 4-fold increased risk of dying from diabetes. So saturated fats cause lipotoxicity. So saturated fats are independently contribute to insulin resistance, even after adjusting for age, gender, weight, alcohol, smoking, and lack of exercise. It's specifically toxic to the beta cells. So when you're looking at this picture, you're seeing that in the acute setting, the free fatty acids will lead to an increase in beta cell mass, which leads to increased insulin secretion to compensate for the insulin insensitivity. But chronic fatty acids actually lead to a reduction in the beta cell mass, insulin secretion, and hence the lipotoxicity. And so what we've found is that if you reduce saturated fats by even 6% in the diet, you can improve fasting blood sugar by 18%. So that's a very big difference. And I think our patients, they believe that chicken and cheese are some of the healthiest foods, and truly, they are the leading sources of saturated fat in the American diet. So most of my patients come in thinking they've done the right thing, going from red meat to poultry, and actually they are eating more of the chicken and the cheese, and they are getting even more saturated fat than they probably were getting before. But so persistent organic pollutants, these are known endocrine disruptors. They bioaccumulate in the food chain. So we now have an environment that has a lot of toxins. These toxins get deposited in the water, in the soil, and in plants, and then animals are fed these grains, or they're eating in the food from the water, and these chemicals, they get concentrated into the fat over the lifetime of these animals. So by the time the animal is grown and is killed for food, you're actually getting heavy concentrations of these chemicals in their fat. In fish, dairy, this is also found in meat and eggs, and it causes mitochondrial dysfunction in the beta cells. There's a strong association with insulin resistance. And we found that even low dose exposure to these persistent organic pollutants increases diabetes by up to 38 times. So we all know the complications of diabetes: macrovascular, microvascular, so coronary heart disease, stroke, peripheral artery disease, neuropathy, kidney disease, retinopathy, all related to glycemic control for diabetes. And we have a nice meta-analysis looking at vegetarian dietary patterns on cardiometabolic risk factors. And you can see here that glycemic control, blood lipids, body weight, all favor vegetarian diets. And we have a meta-analysis of 6 randomized controlled trials looking at glycemic control and vegetarian diets compared to other prescribed diets had a greater reduction in the A1C. So glycemic control directly translates to fewer macrovascular complications. So we want to be telling our patients who already have diabetes how to reduce the complications. So up to 40% of patients with diabetes will go on to get chronic kidney disease. And we have, from the Nurses Health Study, nice view of what happens with people who are consuming more animal protein over an 11 year period of time, they found that there was a significant reduction in renal function in those people. We also have a population-based study looking at 14,000 adults prospectively over 24 years, and they found that a higher adherence to a healthy plant-based diet was associated with lower risk of chronic kidney disease. So diabetics with higher levels of persistent organic pollutants increase their risk of diabetic nephropathy by several times. We also all know that high blood pressure also worsens this condition. So we have a nice meta-analysis published in JAMA that looked at whole food plant-based diets and how it reduced blood pressure through multiple mechanisms. And these include improved vasodilation, greater antioxidant content and anti-inflammatory effects, improved insulin sensitivity, decreased blood viscosity, altered baroreceptors, modification of the renin-angiotensin system and sympathetic nervous systems, and modifications of the gut microbiome. No one pill does all of those. This is through a whole food plant-based diet. The feared complication of painful neuropathy, which affects about 50% of diabetics, it's associated with a significant amount of morbidity. So gait disturbances, foot ulcers, amputations, anxiety, depression, reduced quality of life. Now, our therapeutic treatments really focus on very heavy medications, anticonvulsants, antidepressants, opioids. All of these come with serious adverse drug reactions, interactions, contraindications. And peripheral neuropathy has been positively associated once again with the persistent organic pollutants, increasing the risk twofold. So whole food plant-based diets avoid these animal-derived foods where these POPs accumulate. And we also have some interventional studies that have demonstrated significant benefit for patients with painful neuropathy. So 2 studies. The first looked at 21 patients. They put them on a vegan diet. They found 17 of them within 25 days had complete pain relief. The 4 that didn't had either a slight or partial response. There was significant weight loss in this group, improved glycemic control, blood pressure, lipid panel, and reduction in medications. The second study also looked at putting patients on a vegan diet again. They randomized 34 patients. It was a 20-week intervention, and they again found significant improvements in pain scores, quality of life, body weight, glycemic control, and electrochemical skin conduction. So we should be recommending whole food plant-based diet. There are no side effects and there are only benefits. It reduces high blood pressure, hyperglycemia, inflammation, hyperlipidemia, the advanced glycation end products, and oxidative stress. So diabetic retinopathy leads to diabetic macular edema, neovascular glaucoma, and retinal detachment. And again, we have a dietary systematic review that looked at 54 articles and found that patients with higher intakes of fruit, vegetables, dietary fiber, oleic acid, which you find in avocados and nuts, as well as tea, were found to have a protective effect against diabetic retinopathy. So we should all be recommending a whole food plant-based diet for our patients. It reduces insulin resistance in the skeletal muscle. It improves blood pressure. It lowers hyperlipidemia. It reduces exposure to the persistent organic pollutants, which are specifically linked to mitochondrial cell dysfunction in the beta cells. And it's linked to increased insulin resistance. A whole food plant-based diet reduces inflammation. And they found that vegetarians have an improved adipocytokine profile. So they have lower interleukin-6, C-reactive proteins, and increased adiponectin. Adiponectin is associated with improved insulin sensitivity. And it fosters a healthy microbiome, which helps prevent inflammation associated with type 2 diabetes. So I'm not the only one recommending a whole food plant-based diet. The American Association of Clinical Endocrinologists, American College of Endocrinology, American College of Lifestyle Medicine, American Diabetic Association, the American Heart Association, and the Institute of Medicine. So thank you. Any questions? Great.